As you can see, we have Shannon, the documentary maker, here. Would you like to give her a hand? We have Dr. Alice Domar from Boston, Massachusetts, and thank you. Who you saw on the film. And we have Professor Michael Chapman from the IVF Australia. So I thought perhaps that we could, I thought I might ask a question. I'm sure you've got some, but I'm going to just perhaps kick us off with asking the panel, or particularly maybe Dr. Domar, to talk about the use of complementary alternative medicines, especially treating infertility, what your thoughts are about that, and then perhaps others can kick in.
Well, whenever anyone asks me about complementary alternative medicine, I say there's the good, the bad, and the ugly. And in terms of interventions which are good, those are the ones that are research-based. So there's now been a solid amount of research on mind-body interventions, as you saw tonight. There's pretty good research on acupuncture, and there's good research in the terms of nutrition and some supplements. So those are considered the good. The benign are the ones we don't have any data on, like yoga, massage, chiropractic care. And the ugly right now are probably the use of herbs and Chinese medicine, because we just don't have any data right now to show that they are safe. And there's been one study which suggested lower pregnancy rates in IVF. So that's how I categorize things for infertility patients. So I would steer my patients towards the good, because if you're going to spend time, energy, and maybe money, do something that we know has a very good chance of potentially increasing your chances of getting pregnant and making you feel better psychologically. In terms of massage, yoga, things like that, if they make you feel good and you enjoy them, why not? Do you want to add to that?
Yeah. So I'm obviously a clinician who works in treating infertility patients, and I think I'm good. I'm in the good category, let's put it that way. But the impact of the way people feel, I'm convinced about. That anxiety, stress does play a part in reducing the chances of pregnancy. And I think Ali's work is quite convincing that dealing with that makes a difference. I also have a similar view about Chinese complementary medicines, unproven, perhaps negative. They taste horrible as well. So I would totally agree that let's work on the things in addition to the sort of traditional medicine, the clever things that science has done over the last 30 years in terms of helping people get pregnant. But on top of that, and it varies from individual to individual. You know, people ask me, and on a busy day I see 35 patients or couples trying to conceive, and I often get asked the question, how much is stress playing a part in me not getting pregnant? And I go something like this, because I think it's not huge, but for some individuals it's significant. And so for some people, the mind-body program is going to be the turning point in their efforts to conceive. For others who are, perhaps relaxed with the world, who are in tune with themselves, it probably isn't such a big deal. But for many patients that I see, this sort of program does make a difference.
Okay, now I'm going to feel like the movie Bridesmaids. Does anyone see that, where they compete for the toast? So I just want to say one thing is that I believe the mind-body program is an aspect of integrative care. I mean, I'm an employee of Boston IVF, and I would never suggest that a patient do a mind-body program instead of conventional medicine. I mean, if someone's got blocked tubes, they can do 100 mind-body programs and they're not going to get pregnant. And so I encourage my patients to do both. Why not take advantage of the best of both worlds? So, you get the sense from a couple of the case studies that people tried these things instead of conventional medicine, and I would never recommend someone. I mean, try conventional medicine in conjunction and make this integrative.
Does anybody have a question that they'd like to ask the panel?
One thing that just keeps coming back to me when I was watching that is that I have tried meditation for years, and I do enjoy it.
It's really hard.
It's really
Yeah.
hard. So with everything that I was saying about how it works on certain, to help with certain people overcoming illness, how much is that they actually got it right? Because, you know, I could have gone for 5 years sitting down trying to meditate and still find at the end of the practice, I don't know that I did that very successfully.
Okay, so I would tell you to stop meditating. I cannot meditate. Can you picture this brain meditating? There's just no way.
Good, I'm glad there's someone else
Yes,
like that.
yeah. And the fact is, you know, there's such a personal preference. This is across all personalities and people and diseases and everything else. There's such an individual difference in terms of what you like to do. So, for example, I like doing imagery. I like doing progressive muscle relaxation because it keeps this crazy mind more focused than meditation. The example I give to my patients is the preference for a relaxation technique is very much like the preference for ice cream flavors. So if you came to me and I only taught you to meditate, it's like me taking you out for ice cream and ordering you butter pecan. You know, I personally would rather chocolate ice cream. But so in the Mind Body program, you learn a different relaxation technique every week. And so at the end of the program, you have 10 different techniques. I have no expectation that everyone's going to work for you. But the idea is to try different ones until you find ones that fit for you. There are a lot of people who can't meditate. You know, I personally, you know, yoga's not my favorite thing either. And I'm very honest with my patients about that. But I had a patient years ago who had chronic fatigue syndrome, and he was doing we were running regular mind-body programs. He didn't have infertility. And like halfway through the program, he said, you know what, I'm failing at this. I've tried meditation, I've tried progressive muscle relaxation. He says, I just can't do this. And I said, stick with me. I have never had a patient in my whole career who couldn't do something. And the next session, he learned Hatha Yoga, and it was amazing the results he had. So I would say stop meditating and try other kinds of relaxation techniques, and I guarantee you will find one that'll work for you and will not be hard.
Shannon, do you want to add to that? About your experience perhaps of meditation?
Yeah, I obviously I completely agree that meditation is really, really hard. And I think that a lot of people are trying to find their tranquil forest and they can't find their tranquil forest, and the more they try to find it, the more anxious they get. And I also think that, you know, I've actually been doing some research for a blog post I'm about to write, which is about when meditation can do harm. And, you know, you can actually work yourself up into a situation where I can't meditate, there's something wrong with me, and the anxiety builds. You know, I think I just couldn't agree more with Ali that you've got to find what works for you. And, you know, I had a really, really long conversation with somebody recently who also can't meditate, and you know, she was talking about it in the terms of, you know, I'm failing, there's something wrong with me, you know, all these wonderful meditation teachers are promising me all these fabulous outcomes. And after we talked, we realized that she's a runner, and if she runs, she said, if I run for more than 30 minutes, I get into a zone, and when I'm in that zone, I'm in the moment, and when I'm in that moment, I'm thinking about nothing, I'm just there. And that's ultimately what meditation is, or what this research is showing. The benefits from meditation is when you're stopping that train of everyday thought. So however you get there, it doesn't actually matter. Just stop. Yeah.
I'm a bit biased because I'm a meditation teacher. So my answer would be start very, very short. Just notice the breath. As you walk through every doorway, notice that this is a new moment and that you don't have to be attached to the thoughts that were in the last moment, and just practice. So mine is very much graduation, build up. Sitting at the lights, breathe. Getting out of your car, breathe. Just notice that. That's meditation, being there. Other questions?
Okay, so let me see if I can remember this. We do meditation, progressive muscle relaxation, body scan, breath focus, autogenic training, hatha yoga, imagery. I just finished 3 days of training. Because you're supposed to memorize everything you learned in the last 3 days. I mean, and the idea is like introducing you to lots of ice cream flavors, because there is really at least one technique. Oh, mindfulness, that's 8. So I'm missing 2.
We do cognitive restructuring.
Cognitive on a
But that's
relaxation
not a
technique.
meditation.
I'll think of it, but
Are you seeing it in trends, or is it very individual?
It's very individual. And it's really interesting because in the Mind Body program, people keep what we call a progress note. It's like a diary, and every day they sort of mark how they're doing, and each week they hand it into the group leader so the group leader can see how they're doing. And you see people week by week when they get it, like this light bulb goes off. And like for the first couple weeks, it's a struggle, but they might have tried, meditation or body scan or whatever, and all of a sudden they're like, wow, it just clicks for them. And you heard here that meditation worked for some people and yoga worked for some people. It really is just worth powering through until you find something that works for you.
Up the back.
You just discussed before the good, the bad, and the ugly. So I'm kind of hearing contradictory things here. So is it really that probably we should actually decide for ourselves what's good, bad, and ugly, like what works for us?
No, I'm sorry. I was talking about different approaches, and the ones in terms of relaxation techniques. I don't know if there's any ugly relaxation technique. If it's a standard relaxation technique and you feel the way say, how do I know if I'm doing it right? And I'm like, do you feel better? Yeah, then you're doing it right. What I was talking about was different modalities that people can try. And, I'm a scientist and I feel like I'm a researcher, and so I feel that it's really important that if I'm talking to a patient and everyone that I see is vulnerable, and infertility patients especially are just so desperate to have a baby, and I get very nervous about people that may take advantage of that vulnerability. And so I encourage my patients, and I think Dr. Chapman was saying the same thing, to try modalities that we know at the very least are going to help you feel better psychologically and may well increase your chances of getting pregnant. And I would say it's the same thing to a heart disease patient or a cancer patient or any of the diseases that you heard about tonight.
In the middle.
Could you just give us a bit more information about the acupuncture and how that fits into the Mind Body program, if it does fit into it at all?
They're completely separate entities. I mean, we at my center in Boston, we happen to offer both because we only offer research-proven modalities. I mean, the research on acupuncture has been somewhat controversial because in 2004, the first randomized controlled study came out, which showed a 42% pregnancy rate in the acupuncture patients and a 26% pregnancy rate in the control group, and that was a stunning study. And literally, their programs now where 80% of their patients do acupuncture. Now, since then, there have probably been 30 or 35 studies. Probably half have shown a positive impact on pregnancy rates and about half have not. What everybody seems to be missing is that original study, which is probably one of the better studies done, only included women that had good quality embryos. And if you talk to an acupuncturist and they have access to that patient for 25 minutes before their embryo transfer, the only potential impact they could possibly have on that patient is on her uterine lining. You can't, the embryos are in the lab. And so I believe that in women, if you do just pre and post embryo transfer acupuncture, you have to have a normal embryo to increase the chances of pregnancy. Does that make sense? Yeah.
Um,
I'm sorry?
It's okay.
Oh, we
No, go.
I was going to throw it. Yeah.
Sorry, it's going on.
Yeah.
Sorry, it was really just to inform people. Caroline Smith and I and others are doing what is going to ultimately be the world's biggest proper scientific study on acupuncture. We're up to 620 patients now. I can't tell you the results because they haven't been looked at yet, but we'll be able to subcategorise them into good embryos or not.
Is it pre and post, or is
pre
it
and post? Well, there is one episode of intervention, randomised sham acupuncture, randomised to actual acupuncture at 7 days into stimulation, and then before and after transfer. And we should be finished by the end of this year. Funded, it's amazing. In Australia, we actually get funding from the federal government through NH and MRC to do a study on complementary medicine. It's a significant issue.
What's the science though? Like, how does it help?
As a skeptic, there are varying views about what actually happens in terms of how acupuncture works at all. I'll probably tell this story. I can tell this story. It's because it's against my wife. My wife is having some acupuncture at the moment in relation to some arthritis in her hand, and I had a hip replacement before Christmas, and I've had it dislocated a couple of times, 4 times. And she said, go and see an acupuncturist, but my guy is really good. And I said, I looked up the literature and there is nothing to support it. And she called me small-minded. And I haven't been to the acupuncturist. So I don't believe, And that's one of the reasons that I'm involved in this study, because I have skepticism and I want it proven, because I don't necessarily believe the alleged science behind acupuncture. But it may be nothing to do with acupuncture. It may be this, what they were talking about in the movie, is the placebo effect or the healing effect. And I do believe in that.
I can tell you that I employ 4 acupuncturists in my center, and there have been a lot of randomized controlled studies, not very many on infertility, but there's beautiful data on chronic pain. There's beautiful data on nausea and vomiting from chemotherapy. So there are certain entities where it's pretty clear that acupuncture does help. Is it acupuncture or is it the placebo effect? It's impossible to know, because even if you use a sham needle, if it touches the skin, that may have an effect. Now, when I opened my center and hired 4 acupuncturists, I was not a believer. You know, I saw the data, I'm like, yeah, we have to offer acupuncture. But I have personally been helped tremendously. I've been cured of sinus infections, I've been cured of back pain. And I was a skeptic, and I walk into my center and I can't stand up because my back hurts so much. And half an hour later, the pain is gone. So is it a placebo effect? Who cares? It works.
Yeah.
I'm just wondering, with your trial, I really appreciate it's the only randomised controlled trial of a mind-body program for fertility.
2, done 2.
Oh, sorry, but I just wonder about that kind of concept of an active control group as opposed to a wait list or a no control group, because one of the things that the lovely lady said was that, you know, it's such a lonely journey, and walking in and being part of a group, you're already getting that kind of relaxation effect because you're in connection with people, and when we feel in connection, we feel safe and secure. And so I wonder if you know, just what amount of it is that sort of connectedness on a very lonely journey that gets turned around, and then on top of that, what is the relaxation effect?
You know, it's a really good, did everybody hear the question? You know, we were talking about this at dinner because I've been criticized because I've never tried to tease out the active ingredient.
Yeah.
And my response is, who cares?
Yeah.
The program works. Is it the group support? Very likely, because in fact, women are very lonely. And you know, the example I always give is someone will walk into our group and say, my sister's pregnant, and everyone goes, oh my God, we're so sorry. Because that's what she needs to hear. So there's group support. So maybe, is it the relaxation? Is it the cognitive? Is it that they change their lifestyle habits? Is it they stop running? I don't care. And if I was a really dedicated scientist, I would do research to pick out each, but I clearly am not. I'm more of a clinician.
Mm-hmm.
Do you want to
There was.
Yeah,
Hang
I
on.
mean,
And then
I
I'll go up
certainly think, and you know, we try and get couples, women talking to each other. I mean, we have a website that our patients can actually relate to, and you know, and if you look on the internet, there are a number of them. I was reading a news clip this morning from, it was in a newspaper. I can't remember what it was. It's actually saying that it was the support I got. She was in a remote place. It was the support I got from the website that I think helped me get pregnant. So there is that linkage, and the mind-body program may be all it is that brings people together, but it is important.
We do know it's not a placebo effect because the last study that we did, when women did not wait for the group to start before they did their first IVF cycle, and there were no differences in pregnancy rates. So they knew they were going to do, but they hadn't done a group yet. We didn't see differences in pregnancy rates until they actually did the group, which was a relief to me. Because if it was just a placebo effect, I'm like, I've spent my entire career benefiting from a placebo effect, but it's not just a placebo effect. And it's work. I mean, any of them, you know, where I used to work, there were mind-body programs for cancer and HIV positive patients and cardiovascular disease and chronic pain. So this isn't just something for infertility patients. I mean, you got a little taste with the case studies tonight.
So
but
acceptance and commitment therapy is shown to be very effective in chronic pain, which
Yeah.
is a very common.
yeah.
Just in the middle there, yep.
When you're experiencing infertility, you get all these, there's a lot of different products, there's a lot of different services that you kind of get that are accurate. And what I understand the mind-body connection is really good for pain management, but when we look at infertility and the causes of infertility, for example, endometriosis, you can be asymptomatic, you can be happy in yourself, and you can have stage 4.
Mm-hmm.
So I'm just wondering where's the research to, okay, it may work for women who don't have a known cause for their fertility issues, but for the women that do have a known cause, where does that come from
You start.
Yeah, well, you're exactly right. That I mean, particularly with endometriosis, there is a range, and what each stage of endometriosis does in terms of impacting on fertility is obviously very different. But in any of those stages, if you end up having to have fertility treatment, how your stress and anxiety levels are plays a part in the success of whatever treatment your physician, doctor is suggesting as the way to help get you pregnant. So, you know, it was what I was saying before. Anxiety increases your chance of not getting pregnant. So if you can deal with that bit of it, then obviously the doctor's going to try and give you the best option in terms of overcoming the endometriosis to get you pregnant. But you know, there is this layer above that where the mind-body stuff does play a part. And for instance, in mild endometriosis, which there are significant studies showing that a few spots around the place, even if they cause severe pain, that doesn't physically change the outcome or the chances of getting pregnant naturally. But still women don't get pregnant, and probably it's the anxiety about not getting pregnant that is playing on the whole issue of stopping you getting pregnant.
Ali?
Would you recommend this for stage 1 and 2 or stage 4?
For what, sorry? For stage 1 and 2, you know, in most cases you don't need IVF, for instance. There is a good chance of conceiving without that. Don't be rushed into having IVF just because someone's found a few spots of endometriosis.
Well, I mean, I'm stage 4, I've got it in my lungs everywhere.
Yeah,
That's why
wow.
I was just wondering what, besides pain management, what the mind connection.
If you're, well, I mean, I presume therefore wherever you're being treated, someone is suggesting that IVF is the way to go forward. If that's, and you know, I would probably be saying the same thing. If your tubes are blocked and you've got a frozen pelvis, then IVF is really your only way of conceiving. But the mind-body program is going to enhance your chances of conceiving. I think Ali would probably support that from her own research.
And then
Well, in fact,
we'll have one more.
a meta-analysis came out at the end of January, which looked at 30 studies and showed that women who do this kind of intervention double their chances of getting pregnant. So, just as Dr. Chapman said, Professor Chapman? We're supposed to
Whatever,
say Dr.
Michael.
Professor, Michael. There's a fair amount of data to show that distress, mostly depression more than anxiety, decreases the chances that high-tech treatment's going to work. And so if you do the two things hand in hand, the mind-body program will decrease your chances, it would decrease your distress, and thus allow IVF to work. Does that make sense?
We haven't got a lot of time.
So we'll have to give shorter answers. We'll just do yes, no, yes, no.
Maybe 2 more if we do shorter answers.
Have there been any studies to show the difference between treating the anxiety and depression with medication and the
How much time do you have?
Yeah,
And
it's short.
The answer is yes.
Yes. In fact, there's been a lot of research in the last few years, and we published a big paper in Human Reproduction last year showing that SSRIs, which are the most common form of antidepressant, slightly decreases your chances of getting pregnant with IVF, but can pose some significant concerns during pregnancy, both to you and to the baby. And so, in fact, I was just reading emails to the training group yesterday that people are now using the mind-body program to taper off their antidepressant medication so they can be off medication and then cycle. In terms of anxiety medications, I have not seen research on that, so I don't know if anti-anxiety medications affect IVF outcome. We really focused on SSRIs because we were working with a group of obstetricians who were very, very concerned. They did not want to see patients be on SSRIs while they were pregnant.
I'd like to take 2 more if I can. Susie?
You've got time.
Yep. 2 or 3 more.
The boss says we
Susie?
can do-
So, as a psychologist, there was some reference to counselling in the film. I'm just curious, I'm not familiar actually with the literature around psychotherapy and its benefits in treating infertility as well. That as we know, sometimes there's unresolved issues that cause stress in the present now. Just really curious to hear from yourself or the panel around the benefits of psychotherapy.
You know, I'm a therapist. I spend half my week seeing patients for counseling, individual and couples counseling, and I would like to tell you that what I do is effective, but there's actually never been a study showing that counseling is effective. I know it is, but there's just not been research on it. I think one of the problems is the research looks at people who've done like 3 sessions of counseling, and when you go into counseling and the counselor starts asking you questions, sometimes your anxiety level can go up before it comes down, because you bring up issues and we ask you things. And so I believe in individual and couples counseling, but I can't tell you there's research to support it, but I continue to do it.
Yes, I know no evidence one way or the other, but we do. I mean, most IVF clinics, and IVF Australia is no different, have counsellors built into the service. And I know there are individual patients, anecdotally, who are very comfortable having had multiple, and so you're saying 3, but but the patients who benefit are those that we've seen require help as a clinician and refer to our counsellors. And the notes, I turn the pages and see multiple visits, and the patients seem much happier with themselves. But that's only touching the tip of the iceberg, I'm afraid. What we don't have is the depth, I think, to look at all patients, because the roller coaster ride of IVF, any of you in the audience who've been through it, is awful. It's as I tell my medical students, if we wanted to design a therapy that was a torture for a couple, IVF is fantastic, because what we do is we say, you will get pregnant and we will give you these drugs and you'll get multiple eggs. Wow, I'm going really, really well. I've got the best hormone levels in the world. I'm going to get wonderful eggs. We get lots of eggs. We get 10 eggs, 15 eggs, and we fertilise them, and 10 out of the 15 fertilise. Wow, it's all going really well. The scientist has rung me and I'm really going well. We put an embryo back. And yes, I'm going to be the one that gets pregnant. But the truth of the matter is, even in the best scenario, with the best people in the world, at the end of the day, 60% of the patients that I put an embryo back into will come back to me saying, why didn't it work? 10 days after the embryo transfer, 60% of those patients will not be pregnant, and their whole hopes are shattered. And a lot of my job is picking them up from that and moving on to the next cycle, or whatever.
I might cut you off there.
Sorry,
Michael.
that's one of my preachers.
Take on there. That's okay.
I was enjoying it.
Mind-body balance. Do you find being in fertility, it's quite a challenge in that, unlike cancer, where it might be just one person has cancer, you're actually dealing with couples. So if the woman, she's a good person, she's happy, but she might have a partner, he's the one that's stressed. So his stress is impacting on her. So is that kind of that will impact on her?
Absolutely.
Well-being and happiness. So.
This is the issue. In general, the woman tends to express a lot more distress during infertility than the man does. But when you get the man alone, he'll often say he's distressed too, but he feels like one of them has to be solid or they're going to fall apart. So, even though the literature shows that women are more depressed and more anxious, I think the guys are really hurting, and they just may not express it the same way.
And Ali, you talk about how in couples that they actually get to different points at different times. Would you like to just express that?
With all due respect to the guys, women are almost always ahead. So, they fall in love sooner, they want to get married sooner, they want to try sooner, they think there's a problem sooner, they want to see a doctor sooner, they want to move on to high tech sooner. And so when I sit down with a couple, she's like, he's holding me back. He is keeping me from doing what I want to be doing. And the husband says, or the partner says, she's pushing me to make decisions I'm not ready to make. And so I've actually in my career never seen a man and woman in the same place at the same time. So if you're not in the same place, it's normal. I mean, the guys do catch up most of the time.
But this actually adds to the levels of stress that these
It's
couples are
very tough on
going
a couple.
through. And the women go through so many different levels of stress for family functions and work and their own bodies, as well as their relationships, and as well as financial stresses.
But you mentioned cancer patients. We published a paper, I don't know, 10 or 15 years ago, which showed that women with infertility had the same level of anxiety and depression as do women with cancer, AIDS, or heart disease. And I think 3 more studies have been published showing that infertility patients and cancer patients have the same level of distress. So if you're going through infertility and you're feeling pretty crappy, excuse me, I told you I use bad language, it's a normal reaction to infertility. But that's why we try to do things like the mind-body program, which would get you back to normal. So, for example, with the mind-body program, we give what's called the Beck Depression Inventory to all patients before the program starts and after the program ends, as a way to just see, is it working? And the cutoff for normal of the Beck is a 9. And the average patient to come into the program has a score of 18. And 10 weeks later, her score is 6. So if it's going to work for you, it's going to work really fast in terms of decreasing distress.
So just as we finish, Ali, if I might ask you, the perfect patient perhaps for a mind-body for fertility program, who would benefit from a mind-body for fertility
Female
program?
going through infertility.
Female going through infertility.
I feel like infertility is infertility is infertility. And so, we have patients from age 22 to age 50, every diagnosis, every stage of treatment. And we've actually done research to see, can we predict who's going to benefit the most? And we can't. There's no.
I mean, the truth is, if someone gets to the point of going to their general practitioner and getting a referral into a fertility service, they need help, both fertility-wise, medical-wise, but also the stress of not being pregnant.
Can I take you home with me? If I could get all the Boston, Harvard doctors to say what you're saying, my life would be a lot easier.
So I'd like to thank the panel, if you'd help me thank the panelists, Shannon Harvey, Dr. Alice Domar and Professor Michael Chapman.